Great time, Bill.
Chemo's out of here.
Alright. Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Never introduced him.
No, I can't remember his name, but we...
Napoleon Bonaparte.
Oh, yeah, Napoleon Bonaparte.
Okay, Brad, today 10 questions, top 10 questions you should ask yourself before you have a total knee replacement.
Very good.
Let's start off. Number one, have you tried less invasive methods?
So what are you talking about?
Like physical therapy, exercise, medicine, injections. But the big one that I always recommend is, have you just tried a cane for a while?
Right.
Or a walker?
Right.
Sometimes arthritis tends to flare up and it tends to calm down. Just sometimes by using a cane for a while, it calms down enough that you don't need the surgery.
Right, right.
So, no miracle there, but I mean, have you tried these things? Maybe you have, maybe you're already on a walker.
Right.
So, all right, Brad, you're gonna take number two?
Yeah, do you need help with daily tasks? Every time you get up to dump the garbage, you gotta go out and walk a little farther to the mailbox, and you're having consistent problems with that, you're limping, the pain has consistently becomes severe with those specific tasks.
Yeah, are you relying on other people?
Right,
You know, and that
exactly.
starts to get a little bit old. Everybody likes to be self-sufficient, so I'm talking to you. I should talk to the camera, right?
Yeah, they're the ones who care about this, Bob.
All right, number three. Do you have significant pain daily? You know, even at rest, even at night, is it keeping you awake at night? You know, that night pain. Once you start losing your sleep, I think that's when you gotta start to seriously consider doing something. Right, Brad?
Yeah, oh, absolutely.
I'm glad you agree with me.
The other thing is bone on bone. In other words, really the only way you know if you're bone on bone is if you have x-rays at the doctor, and it's very clear on x-rays if you are bone on bone. And at that point, some people will still resist the surgery and say, I'm not gonna have surgery, so they just won't. But
That was question number 4, but you skipped number 4, so I'll do number 5, and then you go to number 4.
well,
again.
I know that, Bob, but number 2 kind of crossed over with number 4,
All right.
about walking thing.
So let's go to number, I don't know, are we on number 5?
Yeah.
Have you had a knee, do you know that knee replacement surgeries in most cases are very successful? And over 90% are satisfied with
sure.
the surgery. And most last 10 to 15 years, 90% over 15 years.
Sure. Yeah,
So-
they've been doing it for years, they're
So
very
you,
good at them.
you need to know that.
Mhm.
So,
Okay, the
number
next
4,
one.
number 4, Brad.
Does it hurt when you walk?
Yeah.
Again, going to the mailbox, shopping, if
Yeah.
you're shopping, you have to have your cart, and you're consistently leaning on the cart so your knee doesn't hurt, those types of
All right,
things.
this one's a huge question.
Okay.
Brad. Are you medically able to tolerate a surgery?
Right.
Because if you can't, that's off the table. I mean, you're not gonna have surgery. I
Right.
mean, and that's a big one that people run into. And we're gonna get to the next video, but why I think some people wait too long.
Right,
So-
right. But that's pretty much decided upon your doctor.
Yeah, exactly. Number 8, Brad?
Are you having bad days and good days, but more importantly, are you having more bad days and good days? Like Bob said, with arthritis, it kind of flares up and settles down, but overall, if 70% of your days are bad and 30% are good, it's
Yeah,
looking
but
pretty...
it gets down to a quality of life issue, Brad, wouldn't you say? If you're
Yeah.
having a lot of bad days, I mean, who wants to be hanging out in life if you're hurting all the time?
Right.
So, are you tired of being on medication for the knee pain? Especially, are you having side effects from the
Right.
medication?
Right,
So-
I mean, I've had patients come in and they're taking, 800
Milligrams of ibuprofen.
ibuprofen 4
Yeah.
times a day, and, they gotta be concerned about their stomach, their
Stomach, yeah.
kidneys,
Yeah, things start shutting down on you because you're using that, yeah, obviously, it's time to have the knee surgery done. And the final one, Brad, what's the final question?
Are you just plain sick and tired of the pain and the problems you're having? I mean, that's usually what we hear.
Right.
I put up with it for 2 years, I know I should've had it done a year ago, but I didn't want to, and I was just so sick of
A lot
it.
of people have fear of the surgery, I think, and they get so sick of it that it overcomes the fear.
Right, they hear a
So-
couple of bad stories from friends or whatever, and,
So,
yeah,
all
well,
right, gotta get some good knees,
you
right?
better believe it, they're all right here, they will fix them up right. 40 or 50 years and over, you should subscribe to us, because we'll continue with
That's right.
outstanding videos like
Did you
this.
subscribe to us? Yes, we did.
Oh,
Wait,
yeah.
I said no. All right, thanks.
I just broke his jaw.